group in antihypertensive drugs is the RAS inhibitors. We have the AC ARBs inhibitors and also the renin inhibitor. Renin inhibitor, it is an aldosterone, and AC inhibitors and ARBs. AC inhibitors ends with prill, ARBs end with the statin. Both are inhibits the RAS pathway. They are used for the first line drugs for maintenance treatment of the hypertension and also the congestive heart failure with reduced ejection fraction. So this maintenance treatment of the hypertension of the age groups of less than 55 years, because these will have the minimal risk of the sexual side effects, whereas maximum risk were present with the beta blockers and thiazides, and also minimal risk of the orthostatic hypertension, and hypertension maximum risk is present with the alpha blockers. We also having the sacubitril mechanism action. It is a neprilysin inhibitors, inhibits the ANP and also BNP. Side effect of the angioedema and omeprazole, which is an outdated drug, which is a AC inhibitor and also neprilysin inhibitor, which is have the risk of the angioedema. Next, second indication, it is used in the hypertensive crisis or the emergency. Two drugs, captopril, which is present in the active form given in the IV route, and enalapril, which is an active metabolite of the enalapril, and the congestive heart failure, which is a maintenance treatment of the congestive heart failure, because it decreases the cardiac mortality by decreasing the cardiac remodeling, and sequence it is a arnib, which is a valsartan is preferred over the AC inhibitors over the ARBs, and followed by the beta blockers and ARAs. Next, it is a drug of choice for the diabetic kidney disease or diabetic nephropathy and proteinuria and albuminuria. Order will be AC inhibitors followed by the AC inhibitors, ARBs. Instead of this beta blocker, we have the SGLT2 blocker followed by the ARA. And these are AC inhibitors or drug of choice for the scleroderma crisis, because in scleroderma crisis, we have the arteriosclerosis, which is increases the BP, and glomerular sclerosis, proteinuria. And drug of choice for the hypertension with unilateral renal artery stenosis, and losartan. Losartan, it is increases the elimination of the uric acid from body by inhibiting the UAT1 pump, so treatment for the gout, and it also used for the decreases the platelet aggregation by inhibiting the thromboxane A2 receptor, and used for the treatment of the cerebral stroke. Next, candesartan, it is used for the treatment of the prophylaxis of the migraine, and CAP, it is CAP. Next, telmisartan, it is an anti-diabetic property is present because it increases the glucose uptake. It is a PPR gamma receptor blocker, and pharmacokinetics. All the AC inhibitors and ARBs are the products except the captopril and also lisinopril. So captopril, it is a short acting, and lisinopril, it is a long acting drug. All the AC inhibitors and ARBs are eliminated, metabolized by the kidney, whereas ARBs are partially metabolized by kidney and liver. Exception to this rule are the FMT, that is fosinopril and moaxipril and telmisartan. With these are excreted by metabolized by the liver and safe in the CKD. And contraindications are service and contraindication. The mnemonic, it is a captoprils are present. So cough angioedema is present more with the AC inhibitors, because these AC inhibitors increases the bradykinin, not seen with the ARBs. Anemia, because inhibit the synthesis of the erythropoietin in the kidney, and hyperkalemia, therefore avoided with along with the use of the potassium sparing diuretics. And T for the taste changes, which is seen with the captopril, therefore it is given IV. And O for the orthostatic hypertension, which is a rare side effect. It is common. It is increases with other risk factors, that is hyponatremia and dehydration and diuretics. And contraindications are the PRI, P for the pregnancy, because it interferes with the lung and kidney development, and R for renal artery, which is a bilateral renal artery stenosis, and I for the increased level of the serum creatine, a creatine of more than 2.5, and L for the local rash, which is seen with the captopril, which is a red rash, and S for the sprue-like enteropathy, which is seen with the olmesartan, contraindicated in the IBD and IBS. So recent study shows that AC inhibitor increases risk of the pancreatitis.